these two certifications. The first one is the Comprehensive Chest Pain Center, meaning that this hospital is certified as providing the best-in-class care for people with chest pain. The second certification is the Comprehensive Stroke Center. This hospital is designated as one of the best hospitals in the world for managing stroke. Force across the world in identifying the best-in-class hospitals and recognizing them for the good work that they do. We might ask why someone from America has to come and certify us. Why can't we have something local and get that certification? Isn't it better? Definitely Indian standards is because of primarily three reasons. Number one, most of American healthcare follows evidence-based care. When we say evidence-based care, we are talking about coming up with newer technology in care based on scientific evidence. The maximum number of healthcare publications in the world is the key reasons. The second one is their established infrastructure. They are able to provide the best in class care because of the highest end infrastructure. And India, even though we might not have the latest and greatest in terms of technology, but we are definitely catching up. Apollo Hospitals especially has invested heavily in infrastructure and made sure that we provide the best to the patients at every. The best of clinical talent, like the doctors who are sitting on the dais here today, it is possible that we are providing the best-in-class care. So a certification from the American Heart Association means that we are truly the best in the world, thanks to the entire efforts of the team, the hospital, and the entire management as well.
To speak on leading emergency care.
What is the importance of this certification to our country and to our patients? As we all know, the stroke is the fourth leading cause of death in our country and the fifth cardiovascular disease 69 years of age. As the burden of these conditions continues to rise, improving hospital preparedness and reducing the time taken to diagnose and treat patients have become critical on improving survival. In Karnataka alone, we have around 5 lakh stroke rate, placing a significant burden of the state's healthcare system. At the same time, Apollo Hospital Health of the Nation 2026 report of asymptomatic individuals who underwent coronary calcium scoring already showed evidence of coronary artery calcification, highlighting how serious heart disease often develops without warning until the emergency occurs. This backdrop, the dual certification follows an independent evaluation of the hospital preparedness to manage patients with suspected stroke and acute heart attack, from arrival up to the emergency department through diagnosis, interventions, and critical care and continuity of the care till the discharge. In both stroke and acute heart attack, time is heart and time is brain. This is emphasized in our regular practice as the golden hour. In this golden hour, every door, from the time the patient is being investigated, the history is taken, provisional diagnosis is done, early medication is started, early intervention is started, then shifted to the critical care, followed by the multidisciplinary approach until the discharge. So training to the community, which is also benefiting. It's not only the medical support has to come immediately. The public can recognize the early warning signs of stroke and early warning signs of chest pain. So we started training the symptoms of any patient comes with the chest pain and heart attack, and same with the stroke of PFAS symptoms, which our consultants will also continue with us. So here it is making.
We are very proud and honored to come forward you and announce that we are the first center in the country to be certified today for joint stroke and acute chest pain management as the gold standard that can be provided anywhere in the world. As our CEO just put it across to you, why is this AHA certification is a testament to excellence in healthcare delivery to the most vulnerable patient who is having an ongoing heart attack which can kill him, or an ongoing paralysis, the stroke where the brain is dying every minute. How do you prevent further death and bring back the partial injury that has happened, and don't wait for more irreversible damage to happen? Our unwavering endeavor that has gone into creating infrastructure in terms of technology, people's skill, thirdly, putting in that processes in place from the time a patient comes in contact with the security man to the emergency nurse, doctor, then the activate the hospital announcement system where the minute patient is recognized to have this critical illness of either a heart attack or a stroke, a public announcement system goes in that a patient has arrived with this criticality. Everything else becomes secondary priority, and this takes over as though this is a nuclear disaster that has happened, or it's an earthquake that else is secondary. I think most people in the community do not realize what it takes for a hospital system to continuously endeavor to set highest standard of global benchmarks. Today, this certification validates that we are presently equivalent to the best center. You can imagine we are better than 80% of the hospitals in the Europe or America, better than 80% of the hospitals. And we very often, India, we think we are a developing country, but in some of these aspects, we are better than developed countries, one of which is medical health care. When you travel globally, you will understand how great a healthcare we have, and Apollo has been in the forefront of redefining the excellence in healthcare. Our community, our people who live around us gets the best as their minimum when they walk into the hospital. Our endeavor is always to make an excellence as a daily affair, not an exception. So this certification for stroke and acute chest pain, these are the people who are at the highest risk of irreversible damage and poor quality of life if not properly treated. Whole system of the hospital comes to care for this person from the time we receive a call, either from the home by the patient or family to our emergency room or an ambulance. Our people go reach and start the diagnosis and treatment on site. Our ambulances, as Dr. Venkatesh clearly mentioned, in real time starts recording and transmitting the data to the hospital and to the specialist. Even before the patient arrives to the hospital, everybody is ready to receive. It's like a movie scene. You think it's a fantasy, but it's a daily affair at our hospital. And this is being the American Heart Association. So why do we take this pride? Because we like to set the standard of care for everybody else. We push ourselves continuously to provide our own people and community the best that humans can get on the planet with an effort of a cohesive team at Apollo. That is their leadership, owners, the doctors, including the security person, the nurse, the rehab team. Everybody endeavors to give the best chance for this most vulnerable patient. So it gives a matter of great joy for all of us to share with you and tell the community that this is one group of hospital which has made excellence as a benchmark, and this is being validated and recognized by the highest authority who puts the ideal care. There's an ideal father, ideal husband, ideal son. It is an idea for most of them, but there are few people. In the same fashion, there are ideal hospital. There are very few, and we start that journey every.
Achieving excellence in stroke care, may I invite Dr. Surya Narayan Sharma sir to.
Shows that 30% of Indians shifted to ICU, and then other treatment will start. If there is a major large plot, we are going to shift the patient to cath lab. We have 3 cath labs. In two cath labs, we have a CT scan in the cath lab, so that if there is a bleed in the brain, we can pick up in the cath lab only. And after that, we are going to shift the patient to ICU. Now, next thing is about the rehabilitation. Most of the patients don't know that once patient's acute stroke is over, then you take the medicine, patient becomes better. It is not like that. There is a dedicated rehab which program which has to happen everywhere. You may be knowing Dr. Ravindra Rajkumar had stroke 11 years back. He went to Singapore. After that, he came in the same position. Then he went to rehab facility. Now he is walking. He is our brand ambassador actually for our stroke support group. So rehab is as important as the acute stroke treatment. So stroke program is not one person effort. It's a team effort, starting from the identifier of the stroke symptom to the ambulance driver to the emergency team to neuroscience team to we are getting almost patients with stroke with disability. Almost 5 lakh people are getting, living with significant disability because of stroke. There has been a huge change in last 20 years in stroke management. 35% of Indians annually. And if you see, for not coming to the hospital on time. There is a data published by government in January which showed that almost they studied around 35,000 stroke patients across 30 states in India. They say that though so much of advances have happened, only 20% of to ICU to rehab. So this coordinated effort is most important in saving the life of the patient.
Sharma so elegantly he has highlighted what is stroke. Basically, stroke, as all the lay people will understand, is a paralysis which happens to one side of the body or sometimes both sides as well. Patient may be conscious or he may become unconscious. Now, a lot of these stroke patients will have early warning symptoms.
Operational hurdle your team faced in achieving this global certification?
Like we were doing this stroke program and stroke management and chest pain management for a long time. So when we just start thinking of this American Heart Association, when we went to the guidelines and protocols, it's like huge. So first, the important what we learned is training of the hospital staff from up to the discharge in the ward. So we were just thinking that doctors are the only people who can handle all the nurses. But we understood and realized it's not that every second is important, and we are talking like within 60 minutes from the time the patient arrives to treatment completion. So this is what important was. So we started understanding like, okay, the patient enters the hospital, the first security or a transport guy sees. He has to come and inform the doctor. So first let us start training the people there, identifying the importance of it can be a stroke or a chest pain, and then let us talk in the ER, we started creating the triage. So the other important we understood to treat in the quicker manner, because if we won't treat in this early minutes, he may call button just pressed immediately, call goes to all the people simultaneously with a message, okay, there's a patient come, one is a bit of overhead paging, so it's no need for me to call anybody. The transport guy is ready, the
discontinuation, then confidence building counseling for the family, how not to get, blame the person who suffered a heart attack for his lifestyle, or how you also should not be afraid that something terrible has happened. Yeah, it's an accident, but we'll all work together to prevent another accident and bail him out of the current situation. It's a daily affair with a lot of confidence and believe that, he'll lead a good time, because science is the most powerful tool apart from good lifestyle, which can bring the biggest force to give that science to the patient. And we endeavor as a continuous process.
So while it